Good afternoon. First of all, thank you for having me speak today. My name is Jonah Cohen, as you know, and I'm 10 years old. I want to tell you why it's important insurance companies do not deny coverage for people like me who suffer from a pre-existing condition. Last year on April 11th, I was diagnosed with type 1 diabetes. Type 1 is an autoimmune disease. Antibodies in my body wrongly attacked beta cells in my pancreas, probably thinking there was some sort of virus. Beta cells secrete insulin, and without insulin, blood sugar will rise and you will eventually die. When I was diagnosed, I was admitted to the hospital, and my blood sugar was at 480. Within an hour of being admitted, I had an IV attached to my arm, and 2 doctors came at me with shots at the same time. Even though, believe me, I was beyond scared, I now realize how lucky I was. You see, I had medical insurance, and I was covered by my parents' plan. I got to spend 3 days in the hospital while my parents were trained on how to administer an insulin shot, how to count carbs, how to check my blood sugar, how to check for ketones, and everything they now needed to know how to keep me healthy and alive. When we were released from the hospital, we basically immediately went to Walgreens to pick up a giant amount of supplies that are now essential to my survival. And let me tell you, an endless supply of insulin is not cheap. The first month after my diagnosis, I was able to see my endocrinologist every week. A few weeks later, I was lucky enough to get a device that hooked up to my body that checked my blood sugar every 5 minutes, so I would know if my blood sugar is going high or low. Then, a few months later, my insurance covered an insulin pump that administers tiny amounts of insulin in my body and giving me better control over my blood sugar. The good news is it also replaces the 5 to 7 shots of insulin I needed every day. As still to this very day, I hate shots. Another bad news thing, I kind of have this tubing just coming on my side, which it just ruins my style. It's just like, what the heck? Now let's pretend I didn't have health insurance. My family would have to pay somewhere around $25,000 to $30,000 a year for my health care. And that is assuming I don't get sick with the flu or fever, as both of those usually mean a night in the hospital for someone with type 1. I can't imagine how hard it will be for someone with type 1 diabetes to not have health insurance. Because of the high cost of insulin, they would have to limit how much they use. And because they don't give themselves enough, they would have to suffer from the awful consequences of high blood sugar. Because of the high cost of test strips, they won't be able to check their blood sugar often enough to know when they're going high or low. And because they can't afford the insulin pump, they are stuck with shots, so they have less control. And because they are stuck with shots, they can't eat more than 4 carbs between meals. This may not seem like a big deal to you, but it is to a kid. Before I was on the insulin pump, I'd go to afternoon birthday party and watch all my friends eat snacks and cake without me. I felt so angry and left out. I kept wondering why this had to happen to me. They say over the next 20 years, the number of people with type 1 diabetes is expected to double. As of now, there is no cure. And that'll be a lot of people out there with a pre-existing condition. If Congress decides to let me and other people down with this disease, many of us won't survive. Life is hard enough for people living with type 1 diabetes. There's no break from this disease. It is with you every minute and every hour of the day. Please don't make my life harder than it already is. Please do what you can to convince Please do what you can to convince Congress to make sure insurance companies do not deny coverage for people with pre-existing conditions.
All right.